Quebec announced new measures today aimed at the unvaccinated. Starting January 18th, people in that province must show proof of vaccination to enter an SAQ, the province's liquor distributor. The new rule also applies to the province's cannabis stores. The government will eventually expand the vaccination passport to other non-essential businesses. It's currently in talks with multiple industries. And eventually, people who want to use the provincial passport system will need 3 doses instead of 2. All of this as Quebec continues to see increases in hospitalizations and ICU admissions. Dr. Jesse Papenburg is here to talk with us about the COVID-19 situation in that province. He's a pediatric infectious disease specialist and medical microbiologist at the Montreal's Children's Hospital, and he is, of course, in Montreal. Doctor, thanks for joining us today.
Thanks for having me.
So the announcement from Quebec today seems to target the unvaccinated. What do you make of this specific approach that Quebec seems to be taking?
Well, Premier Legault has been threatening to put in further restrictions to unvaccinated individuals for quite some time now, a couple of weeks at least. This is, I think, the first one that we're really seeing in terms of a new measure. And if you ask me, is this restriction not allowing them to go into liquor stores or cannabis stores going to limit their social contacts enough to really make an impact on community transmission? No, of course not. But I think it's just one more way to try and incite unvaccinated individuals to get their COVID-19 vaccines. And I think that further restrictions are on the way to further kind of squeeze the unvaccinated and pressure them into getting their shots.
During his press conference, the health minister mentioned the fact that I think around half of the people in ICUs right now are there with COVID. Is this how the province should be tackling the rising hospitalizations then?
No, I think that this, again, I don't think this is going to have a huge impact on community transmission and hospitalizations. But I think we have to realize also that this relatively small proportion of individuals who have chosen not to get vaccinated represent roughly half of the hospital admissions and ICU admissions for COVID-19. So really, we wouldn't be in nearly as bad a state if all adults had chosen to get vaccinated. So I think really this is almost part of the social contract that Premier Legault is trying to put into place, where really if you want to have certain liberties, then you really need to get vaccinated for the good of the population.
It's interesting. It's not forcing people, but it's reducing options, one by one by one by one. Life gets more complicated if you don't, right? So eventually, as we heard, people who want to use the provincial passport system will need 3 doses to be considered fully vaccinated. Given the fact that people with 2 vaccines can still get infected right now, and you're even hearing about people with boosters, how do you think this new rule will resonate with people?
Well, I think it just needs to be explained properly in the sense that people who are familiar with vaccinology and immunology, I think for quite some time now, we realized that the primary series of COVID-19 vaccination is not just the first 2 shots, but it was going to require a 3rd dose, or what we're currently calling a booster. But I think it's actually really part of the basic immune response that we're trying to elicit. It really needs that 3rd dose, and I think we're going to see a much longer immunity with that 3rd dose than we have with the 2nd. So I think it's just explaining in a way that really the 3rd dose is now part of that primary series. It's not really, I think in time we're going to see it not so much as a booster, but as part of what you need to get vaccinated with to have protection on the long term from COVID-19.
Let's take a look at the stresses on the healthcare system. Now, I was looking at the numbers today. So health officials are predicting that within 2 weeks, hospitals in Quebec could have 3,000 hospitalizations, 400 patients in the ICU, and at the same time, some 20,000 healthcare workers are off because of COVID-19 infections. How is the province going to manage all of this?
Well, it's certainly a scary situation, and certainly I think there's a lot of anxiety amongst healthcare professionals and healthcare workers. Already, we're covering for our colleagues' shifts because people are either sick themselves or are in quarantine due to close contacts with COVID-19 cases. Everybody's pitching in, there's no doubt, but hopefully we won't go beyond our capacity in terms of the healthcare system. But I think what we're going to see in certain services, certain hospitals are going to need to cut back on other services, whether it be diagnostic procedures, surgical procedures, elective type of procedures, in order to be able to fully accommodate the ever increasing number of patients that require hospitalization for their COVID-19 infection.
So testing is the big thing now, especially self-testing. We know that case counts underrepresent the amount of COVID-19 cases in places like Quebec, where PCR tests are limited. So Quebec is planning to set up an online system where people can, declare their positive rapid test results. How helpful do you think that will be?
Well, I think it's a great initiative. I think it should have been put into place earlier, as the government was planning to hand out rapid tests to the community for testing at home. It will help us get a better sense of who's getting infected, how many infections there are, and importantly, also you have to understand that the vaccination program in Quebec does consider that an infection counts almost like a dose. So, in other words, somebody who's had 2 doses of their primary series and gets a COVID-19 lab-confirmed infection, they're currently not required to get a 3rd dose, or vice versa, if they'd first been infected and then followed up with their 2 primary series doses. So I think it's important that we get a system in place whereby people who have a confirmed infection, either by rapid test or PCR in the lab, are able to have that registered through public health.
Are there risks associated with the fact that you're still asking people to do it and sort of, relying on self-reporting when the results are made?
Well, that's an interesting question. I think people will be motivated to do that reporting. I think they realize it's of both public health importance and relevant to their own health status and their ability to receive vaccines later on. So, no, I think people will be motivated to do that reporting. I think I'm concerned that perhaps there are some segments of the population that maybe are not as tech savvy that will have trouble if it's a web-based type of application or an app on your phone. Nevertheless, I think instituting this reporting system is certainly a step in the right direction.
Doctor, thank you. I appreciate your time.
It's always a pleasure.
Dr. Jesse Papenburg in Montreal.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.